Marijuana. What is it? Marijuana is a word used to describe the dried flowers, seeds, and leaves of the Indian hemp plant. On streets, often known as Mary Jane, grass, and weed, on average, hash is 6 times stronger than marijuana. Cannabis describes any of the different types that come from the Indian hemp plant. Marijuana has a drug, which is a hallucinogen caused by the chemical substance THC. Marijuana history. As many as 2,000 years ago, marijuana was used to achieve euphoria. Chinese medical use from 2737 BC. The use of marijuana spread it from China to India to Africa to Europe. Did you know marijuana was prescribed for various conditions, including labor pains?
People that use it legally in the US, 1,137,069, and recreationally, number was 55 million people. And the states that have legalized it so far, 23 states. So one of the benefits of legalizing is going to increase tourism. It also it's going to reduce the debts. It's going to reduce the debts. There will be tax on weed. And then we can also use the money to fund schools. Then we can also create more jobs. Talking about more jobs, we found out that in Colorado, the legal weed created 1,005 full-time jobs. Another 2.4 billion to Colorado state economy alone. In California, it was projected that the total size of cannabis market is 6.45 by 2020. As you can see, there are a lot of benefits of legalizing marijuana, because number one reason is it's going to reduce the debt, it's going to increase tourism, it's going to create more jobs.
Hello everyone, so here I'm going to talk about the difference between indica and sativa. So indica is more sedating, it relaxes you, and you may use it before bed. The way it looks is just short and bushy, and some symptom reliefs are anxiety, insomnia, pain muscle spasms, as where in sativa it's more uplifting and you may feel creative, happy, and energetic. The way it looks is just tall and thin. Some symptom reliefs for sativa are depression, ADD, fatigue, and mood disorders. So now we're going to talk about recreational and medical marijuana, as where in recreational, that person might not care which strain they get, whereas in medical marijuana, that person wants to know which strain is best for treating a specific symptom. And as where medical marijuana, it's grown organically and under strict care. And although you may know how recreational marijuana is grown in a dispensary, there's just little chance in knowing how cannabis is grown when it's bought off the street. And some places where marijuana are in medical marijuana dispensaries. They do have strict rules who can buy the cannabis. And under a licensed dispensary, anyone who's 21 and over with a valid ID can buy the cannabis. People just go the easy route and just buy cannabis off the street.
Alcohol versus marijuana. Now you might be wondering, which one's worse? According to Dr. Aaron Carroll, a professor at Indiana University School of Medicine, overall, alcohol is more dangerous. Why? While a lot of people associate drugs with crime, most of the criminal activity tied to weed has to do with illegal distribution, not violence committed by pot users. On the other hand, there are hundreds of thousands of documented crimes a year associated with alcohol, especially violent assault. However, Dr. Carroll states that research shows rates of domestic violence are actually lower in people who smoke marijuana. Research also shows that 9% of people who experiment with weed will become dependent or abuse it, while the percentage that later becomes dependent or abuse alcohol is greater than 20%. CNN reports that about 88,000 Americans die each year because of excessive alcohol use. While there have been no documented reports of someone dying because of overdosing on cannabis, weed can still kill you. Marijuana affects your reflexes, hindering your motor skills, which increases your risk of getting in a car accident. Also, one study found that marijuana users have a 4.8-fold increase in risk of heart attacks during the first hour after smoking, due to the drug's effects, which include rapid heartbeat and sometimes even panic attacks or anxiety.
The long-term use of marijuana can cause long-term effects, some of which, but not limited to, apathy, drowsiness and lack of motivation, personality and mood changes, increase of abnormally structured cells in the body, growth disorder, reduced sexual capacity, suppression of the immune system, rapid destruction of lung fibers and lesions to the brain could be permanent, study difficulties, and reduction of male sex hormones.